Tetralogy of Fallot has been on the NCLEX recently. Don't know what it is? I'm about to break it down for you and make it really simple. So make sure that you watch this until the end. Tell you exactly what you need. More, no less, no fluff. Let's go past our NCLEX. 4 defects happening all at the same time. The tornado going on. It causes cyanosis because the blood can't get back to the lungs to pick up oxygen. First problem is there's pulmonary stenosis. What does that mean? Narrowing at that pulmonary valve. The blood can't easily leave the right ventricle to go to the lung. Pressure builds up in that right ventricle. This is the main reason why a shunt is placed. The second problem is something called VSD, ventricular septal defect. What is happening here? There is a hole in between the right and the left ventricle. The blood can pass through both ventricles, backflow. Normal VSDs are from left to right because that left side has more pressure. But with Tetralogy of Fallot, because of that pulmonary stenosis, right side becomes higher in pressure and the blood wants to go from right to left through the VSD. That's a problem. Why? Because that means there's deoxygenated blood entering into the body, which is cyanosis. If the blood has no oxygen carrying it through the body, you get cyanotic. The third problem is you have an overriding aorta. Muscles, when you work them, get thicker, so that stenosis gets worse. This is the result of an obstruction. That's not the start of the problem. That's what happens as a result. The fourth problem with TOF is your right ventricular hypertrophy. Obviously, it's overworked, so the right ventricle gets really thick. It's like the pulmonary stenosis. I want you to think, it starts with a pulmonary stenosis. Blood is not able to get into the lung to pick up oxygen. And that right ventricle pressure increases. Blood shunts from right to left with the VSD, that septal defect in between the ventricles, which then leads to aorta override and sends unoxygenated blood to the body, which then causes cyanosis. We see this in our pediatric patients. That's why when you see pediatric patient TOF, they usually have blue baby. It's cyanotic. Deoxygenated blood skips the lungs and goes straight into the body. The baby looks blue. And you get your TET spells. Sudden episodes of severe cyanosis, hypoxia, they get irritable, possible syncope or seizures. Look for these signs in the question and the baby. This is a good one for a case study or a bow tie question. The triggers the NCLEX loves: crying, feeding, stooling, and exertion. If you see those and you know it's a cardiac issue, think Tetralogy of Fallot. When the baby's feeding and it gets irritable, strains and it gets upset, oxygen demand needs to be increased immediately. There's more blood bypassing the lungs. Hypoxia worsens fast. What do we do for TET spells? E2 chest positioning or squatting. Why this works, the chest, it helps increase that systemic vascular resistance. So it pushes blood back towards the lung and it decreases that right to left shunt, improves oxygenation. Another correct action that the NCLEX might want you to do for treatment is give oxygen. Keep the child calm and comfortable. You can give them morphine if there is an order. It will decrease their crying, which will decrease that cardiac workload, which will then decrease that pulmonary resistance. Your order of thinking: need a chest positioning, oxygen, calm them, and then give meds if they're ordered. Like my teaching, comment down simply NCLEX and I'll send you over all of the information. I go over this in the course and I go over over 100 other topics. So make sure that you go grab that if you are ready to pass your NCLEX with confidence and less stress. Hit all these buttons for me. Stay tuned for the next video and happy studying.